Okay, you're gonna grab a med ball. We're gonna work on kind of a hip mobilization where we are coupling a hinge with like pelvis on femur rotation, where we're kind of dropping the pelvis in towards that hip. What we're looking for is a lot of length on the back side of the hip. So what you're gonna do is you're gonna start in a kickstand position. So there's the hip we're gonna be working. The other foot's just gonna drop into like a kickstand stance. It's there for balance, but I don't really have a ton of weight through that foot. I've got my med ball front rocked, and I'm gonna kind of think about lifting it up just a bit. That's gonna prevent us from just flexing and rounding through the spine as we do this. So what you're gonna do first is, to make sure we got a good hinge, we're gonna keep weight forward on our foot, soft bend in the knee, tailbone is ever so slightly lifted, meaning the pelvis is kind of a little bit of an anterior pelvic tilt here. We're gonna send those hips back, lifting the glutes, and then what we're gonna do is we're gonna drop this kickstand leg towards the hinging leg, which is gonna really tension us through here. You're gonna pause, and then you're gonna contract these glutes to drive out of it. What I want you to be mindful of is once you come into your hinge, you're not just rotating through the spine. So I want you to see me from the front here. I'm hinged. The movement is coming from me dropping my pelvis towards this side. That's where that rotation comes from. So mobilization to the backside of the hip, just keep weight forward on your toes or on your foot, lift the glutes, drop the pelvis in, get that length, and then use your glutes to drive out of it.